Houston chiropractor, Dr. Gregory Johnson again, and we're back with Bo. Now, you just heard his great testimonial, and we really appreciate him for talking to you about that. But if you have a hiatal hernia and acid reflux, or even if you don't have acid reflux, but you got that really full, tight feeling in there that's causing you pressure and pain right below your sternum or underneath your sternum, you need to come in and get checked, because it is most commonly a mechanical problem of the mid-thoracic spine, the rib cage, and the diaphragm, and how all that works together. And so right now I'm going to show you exactly what we've been doing to treat him effectively for that. His rib cage on the left side was sticking out an inch more than the right one when we first started, and now it's exactly even. And we've been getting movement, like today, this morning, we got better movement in your ribs than we have the whole time. So this takes some time and repetition, but it's just like anything. It's just like if you were going to the gym. You can't go to the gym and get in shape in 1 or 2 visits. You got to go 2 or 3 times a week for a month or 2. Well, we got a good start on Bo. He's going to go back and he'll visit his chiropractor that he was talking about back in Nashville, get some treatments there, and then hopefully we can get him working on his stomach a little bit more like I'm doing. And then he's going to come back down to Houston and visit us again and do some more professional videos, because that's what he does professionally. He's a great guy. He's a martial artist like myself. And so we've had a lot in common. We've had a great time here, and we welcome him to Houston. Anytime he wants to come here, he's welcome here. And we just appreciate him and his wife being here. And
I'll say this too, if I didn't live so far away, and this is my chiropractor, it's just I live so far away, this is the only chiropractor I would see. And I will drive again or fly or whatever to come back down here and get some more to further, because of the intensity and the fact that he's got it figured out and he does so much to help fix it. So I'm just looking forward to, we're thinking about actually staying a couple of days, maybe Monday and Tuesday. My wife and I are talking. I'm not sure if we're going to be able to work it out. We're going to try to do that, okay?
Well, good. So if people are living around the country and are thinking about, is it worth coming to Houston to see Dr. Johnson, what would you tell them?
That was a real deep breath. I couldn't hardly get very many of them before. I had this real shallow breathing, and you just don't know.
But you haven't belched one time.
I haven't. I had this terrible belching, horrible belching. My wife was about to divorce me over the belching, and I haven't, to yesterday, very little. Today, almost none since I've been here. So yeah, this is an absolute miracle for me, and to be able to take the deep breaths almost when I want to. I mean, you think that's no big deal because you're breathing normally and you just take deep breaths when you want to, but when you lose that ability to take a deep breath, it is, and doctors diagnosed me as having an anxiety syndrome, and one gave me a pill and said, well, you just got an anxiety syndrome.
Yeah, he looks really nervous.
Isn't it funny that when he adjusted me that I didn't have an anxiety syndrome, which I knew I didn't have.
Because it wasn't anxiety, yeah.
It was a mechanical failure. There's something out of place. And I knew it was out of place. And it tightened my diaphragm up, and my stomach was raised up, and I just couldn't get that deep breath. But I knew that it could be fixed. And when it's a mechanical thing, if your brakes are out, you know, you don't go and water your lawn.
That's right. Yeah, that's true.
You got to diagnose what the problem is and then go fix it there. So anyway,
he's very knowledgeable, much more than a lot of people. So welcome to Houston. Come visit us anytime.
I'm older. I'm 61 years old, so I'm supposed to know something.
He looks great for 80, huh? Okay, let's take a look.
Felt 80 when I first got here.
Okay, now let's take a look at you here. Flex your head forward and backwards for me. And see, he's got much better range of motion. I don't know if you remember the first video on him, but I mean, his extension's 100% better. He's still a little translated to the right, so that makes him have a little bit of a curvature, scoliosis on this left convexity here, and that's the side of his ribs that were sticking out more. So that's part of the mechanical problem right there, but it started up in his neck and upper thoracic region. But that affects the mid-thoracic region and also the thoracolumbar region, which is right where the diaphragm attaches to the lower part of the rib cage. So first thing I'm going to do is I'm going to decompress him. And Bo has just started getting this done, and this is one of his all-time favorite adjustments already.
Oh,
I'll slide you down this way a little bit more, Bo. A couple more inches. There you go.
I call this the steel mare.
Yeah. I call this one the ring dinger. I get them all. Some people call it the rack. It's really, I actually perfected this adjustment over the years. Learned it from another chiropractor in postgraduate education. And as far as I know, there are only 2 of us in the U.S. right now that are doing this. And I don't think he's even doing that much more. And he's down in St. Pete, Florida. So, I'm gonna get I changed towels and got a really strong, nice blue one that's thin so I can get a really good grip on it. Okay, so let's have you lift your head up just a bit. There you go. Good, now lay it right on back. And then we have him breathe through his nose, keep his teeth together. There we go. Boy, that was perfect. See, we get movement all the way from his skull down to his sacrum every single time. Very good. Now, I'm going to do this one here easy. Yeah, that's it. Perfect. Boy, that's moved a lot better this afternoon, too. Good.
Yabba dabba do.
Would you mind taking your shirt off?
Right now?
Yeah. I'm going to grab another towel so I can put down on this table. I'm going to do some really deep tissue work on his thoracic spine. There we go. And I use some deep blue emu oil. It's extra super strength blue emu oil. Get it warm in your hands here, and then you put it on the spine.
Oh, that's really sore there.
Yeah. Now he's got some sore spots because I'm gonna tell you something. I've been leaning some serious weight into him. I'm leaning pretty much all my body weight into him, so I'm gonna take it a little bit easier on him this afternoon. But I'm still gonna show you the technique for it. And it's my elbow. And you always want to make sure you're to the side of the spine. You don't ever want to get right on that spine's process because then it really hurts. But you start slow, then you get deeper. Then I'm just sliding up slowly. Right along, see, he's starting to feel it right there. Right along the edge of the spine. All the way up.
Spinous erectus.
Yeah. These are the erector spinae muscles, and they go all the way from the occiput down to the sacrum. Now I'm working up into his traps even. And come right back down into what I call the pocket right at the very base here, which is the quadratus lumborum, multifidus, and erector spinae attachments. Then we're getting on this other side. And you can see he's got a lot of these little round, hickey looking things on his spine. That's from getting some acupuncture treatments with some Chinese suction bottles. Isn't that what they're using? Those little Chinese suction bottles?
Yeah, that's part of what they're doing, plus acupuncture.
And acupuncture in there as well. Bo has, I'm going to tell you something, he's done more research and he has really boned up on everything from nutritional aspects of treating this disorder to the mechanical and chiropractic. And
well, most people live with it for years. I wasn't going to do that.
yeah, he wants to have a life for the rest of his life, and I don't blame him. I'm going to grab a Kleenex here real quick so I can get a better grip on him. This is one of the things that's helped him a lot too, is I've gotten a really good oblique lateral stretch right from his right SI joint all the way up into his thoracic spine on the right side. And as I'm contacting his left SI joint, I'm pushing it down and out, and then his upper thoracics, I'm pushing those up and out. So we're getting a oblique superior stretch in all these paraspinal muscles. And I felt quite a bit of movement this morning in his ribs when we were doing this, more so than any other time. I'm using this Kleenex so my hands don't slide on him. There we go. And you can see I'm putting my entire body weight into this, so. Okay, good.
Oh, it feels so good. That is awesome. Oh, oh.
There. See where I get my workout every day. Yeah. But Renee and I have really enjoyed Bo and his wife being here all this week, and they've just been a real pleasure to work with. A lot of fun during our visits and taking care of a lot of things. Plus, I showed his wife some maneuvers. Go ahead and turn on your back now. I showed his wife some maneuvers, actually, so that she could work on him at home and continue this process. So right now, see, you can see his rib cage sticking up just a little bit here on this left side compared to the right side. So I have actually just been contacting that, and while he's breathing, yeah. So I'm going to take it easy because it's tender from me moving all that this morning. And this is the bottom part of the rib cage is all cartilaginous. So you don't want to be doing any thrust or anything on that. And you just, right now I'm just working with his breathing and stretching, and then working right where the ribs attach. You felt that one move? Right where the ribs attach to the sternum and pushing those out laterally. That one moved too. That one did too. Yep. Yeah, and we got every one of those.
Same ones.
Yep, take a deep, deep breath in. Now, this is the important part. I'm going straight down underneath of his xiphoid process, and then I'm doing a straight pull down with a little bit of torque to it. And another one. There we go. Right there. There you go. You feel that big old gas release right there? A lot of times when you get it on top of the fundus of the stomach and you pull that down, you'll feel a big old gurgle or gas release bubble under there. There you go. Just keep blowing out. That's it. That's it. Good. Boy, that's the deepest we've gotten. Now see, I've been working on his ileocecal valve over here. That's the valve between the small intestine and the lower part of the stomach, and the small intestine and large intestine, the ileocecal valve, ileum, and then cecal meaning the colon. And then over here is the valve that goes between his colon, lower colon, and his rectum. And we get in there deep on those, and we move those around in kind of a clockwise fashion. Now, Bo has had a lot of abdominal spasms over the last few months, right, Bo?
Last month and a half.
Last month and a half, 2 months. Yeah. And so I've actually been working on his abdominal region here, getting down into down a little bit below the muscles themselves, the abdominal muscles, and getting into the colon area and doing basically a little colon massage on him. And you want to be very careful. You don't want to be doing this stuff at home if you're not trained, or have somebody that's been trained show you exactly how to do it. I know a lot of people watch our videos and think they can go adjust people and do those decompression adjustments. I do not recommend that you do those at home.
Don't do that. Don't do that.
To anybody. I don't care if it's your family member or your worst enemy, because you can really hurt someone seriously. And by seriously, I mean you could kill somebody if you did it wrong. Excellent, my friend. Good job. So now that we've got him adjusted there and got his stomach pulled down, now I'm just going to check his knees and his hips again. There we go. Good. Got those. Excellent. Good.
Got that.
Yep. Okay. Let's have you sit up this way, and I'll have you face towards Renee. There you go. Good. Now see, he knows how to get up properly and do all the right things, so he's the kind of patient that we like working with, because he does his part too. But you know what was the first thing I told you about eating stuff on Monday when you came in? I told you to go eat anything you wanted to eat. Steak, baked potatoes, anything. Cajun food.
I have.
And we got a lot of Mexican food restaurants and Cajun food restaurants here in Houston. And he's actually been out eating that kind of food and doing better, right?
I can't eat as much as, my stomach's still small, but I've been able to eat pretty much what I want to.
Yeah.
Within limits. I mean, I still take it. I knock some of the spicy stuff off the Cajun food, but I eat bread and peas, beef, and steaks, and venison, things I couldn't even begin to eat until I got here.
And he was getting pretty much a liquid diet prior to
I was
coming
eating
here.
living on goat yogurt and eggs and avocado, sometimes together, sometimes separate, and sometimes a couple other little things, but not much. Some almonds with the skins pulled off of them, almond butter. Very limited diet, very limited, and worried about it each time I ate even that. So it just feels so good to be able to eat and not have a reaction, and not have. I didn't ever have acid reflux. I got the hiatal hernia, and the hiatal hernia caused the acid reflux. You pull the hiatal hernia, fix the mechanical condition, and the acid reflux.
Get the acid.
It's way down. I may have not even had enough stomach acid. At my age, you get less stomach acid, so. I didn't want to live on those pills, and I don't want to go to that whole route, and so I just kept seeking, knowing there was another answer, and I felt very fortunate and blessed to have the opportunity to come here. There was somebody that did this, that does this, knows how to do it, and can do it, and I'm here having it done, and I feel a jillion times better.
That's great.
I may not look a jillion times better yet, but I will.
He's
Trust
getting
me,
there.
I'm going to get there.
But we really just want to say thank you to Bo and his lovely wife for coming down here and giving us an opportunity to help him. And wherever you live, I don't care if it's in Saudi Arabia or over in the UK or Australia, if you can get over here for treatment for 4 days in a row, twice a day, we'll make progress on your hiatal hernia, and I'll teach you how to do things at home that you can help yourself with. But until next time, this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you.
He does the best he can possibly do for you. You can trust,
every visit.
You can trust that.
Thank you. All right. Thank you, Bo.
Sure.